Most people think their eyes only reflect vision problems or aging, but in many cases, your eyes can become one of the earliest warning systems for liver damage long before severe symptoms appear. Subtle changes in the color of your eyes, the skin around them, or even the blood vessels inside the eyes may indicate that your liver is under serious stress. And the reason this happens is deeply connected to detoxification, hormones, metabolism, and nutrient storage inside the body. One of the most important warning signs is yellowing of the eyes. This occurs when bilirubin levels begin to rise in the bloodstream. Bilirubin is a yellow pigment produced when old red blood cells break down. Under normal conditions, the liver processes bilirubin efficiently and removes it through bile. But when liver cells become damaged or inflamed, bilirubin starts accumulating in the blood and tissues. The white part of the eyes, known as the sclera, is especially sensitive to these changes. In many cases, yellow eyes appear before significant pain or obvious liver symptoms develop. What makes this even more concerning is that bilirubin buildup often reflects deeper metabolic dysfunction inside the liver. The liver is responsible for filtering toxins, processing medications, regulating cholesterol, balancing hormones, and managing blood sugar stability. When this organ becomes overloaded from poor diet, fatty liver disease, insulin resistance, alcohol exposure, or chronic inflammation, its ability to clear waste products declines dramatically. Insulin resistance plays a major role here. When insulin levels remain elevated for long periods, fat begins accumulating inside liver cells. This condition, commonly known as fatty liver disease, reduces the liver's ability to perform normal detoxification. Over time, chronic inflammation develops, blood flow inside the liver becomes impaired, and oxidative stress starts damaging liver tissue. As this progresses, bilirubin clearance worsens, causing visible changes in the eyes. Another major issue involves bile production. The liver produces bile to help digest fats and remove toxins from the body. When bile flow becomes sluggish or blocked, bilirubin cannot leave the body efficiently. This condition places additional stress on liver cells and often leads to symptoms like yellow eyes, pale stool, dark urine, and digestive discomfort after fatty meals. In some people, poor bile flow also reduces the absorption of fat-soluble vitamins such as vitamin A, vitamin D, vitamin E, and vitamin K. Vitamin A deficiency is especially important when discussing eye health. The liver stores large amounts of vitamin A, which is essential for protecting the surface of the eyes and maintaining healthy vision. If liver function declines, vitamin A storage and conversion become compromised. This can contribute to dry eyes, poor night vision, irritation, and increased sensitivity to light. Many people treat these symptoms as isolated eye problems without realizing the liver may be involved. Hormonal imbalance is another hidden factor connected to liver stress. The liver helps break down excess hormones, including estrogen. When liver detoxification slows down, hormone levels can become unstable. Elevated estrogen levels may contribute to the appearance of tiny spider-like blood vessels around the eyes and face. These vascular changes can sometimes signal impaired liver metabolism and chronic inflammation occurring beneath the surface. Chronic liver stress also increases oxidative damage throughout the body. The liver normally produces powerful antioxidants like glutathione to protect cells from free radical injury. But when liver function weakens, oxidative stress rises dramatically. This affects circulation, immune function, and tissue repair, including delicate tissues in the eyes. Bloodshot eyes, inflammation, and persistent puffiness around the eyes can all reflect this deeper systemic imbalance. The frightening part is that many people ignore these early warning signs because liver disease can remain silent for years. Fatigue, brain fog, abdominal bloating, unstable blood sugar, and eye changes may slowly develop while liver damage continues progressing unnoticed. By the time severe symptoms appear, significant metabolic dysfunction may already exist. This is why protecting liver health is critical for the entire body. Reducing sugar intake, lowering refined carbohydrates, improving insulin sensitivity, supporting bile flow, and increasing nutrient-dense foods can dramatically reduce stress on the liver. Nutrients like choline, zinc, selenium, vitamin E, and antioxidants from cruciferous vegetables help support detoxification pathways and cellular repair mechanisms inside the liver. The eyes are not separate from the rest of the body. They are closely connected to circulation, nutrient delivery, hormonal balance, and detoxification systems controlled heavily by the liver. So, when your eyes begin showing unusual changes, your body may be signaling that deeper metabolic damage is already developing internally. And recognizing these signs early may help prevent far more serious liver complications in the future. Dark circles and puffiness around the eyes are often dismissed as simple signs of poor sleep or aging. But in many cases, these changes can actually reflect deeper metabolic stress happening inside the liver. Your body has an incredible ability to send warning signals long before major disease develops, and the delicate tissue around the eyes is one of the first places where internal imbalance can become visible. The skin around the eyes is extremely thin and highly sensitive to changes in circulation, inflammation, fluid balance, and nutrient delivery. When the liver becomes overloaded or begins functioning inefficiently, these systems start breaking down. As a result, the eyes may develop persistent puffiness, swelling, dark discoloration, or a tired appearance that doesn't improve easily. One major reason this happens involves poor detoxification. The liver acts as the body's main filtration organ. Every day, it processes hormones, medications, environmental toxins, alcohol, metabolic waste, and inflammatory compounds. When liver cells become stressed or fatty liver disease begins developing, detoxification slows down significantly. This allows inflammatory substances and waste products to accumulate in circulation, increasing oxidative stress throughout the body. That inflammatory burden directly affects blood vessels and lymphatic drainage around the eyes. Fluid begins collecting in the soft tissues beneath the eyes, causing puffiness and swelling. Inflammation also weakens circulation in tiny capillaries, leading to darker pigmentation under the eyes. In many people, this becomes more noticeable in the morning because fluid retention worsens overnight. Insulin resistance is another major factor connecting liver dysfunction to changes around the eyes. Chronically elevated insulin levels drive fat accumulation inside the liver, a condition known as non-alcoholic fatty liver disease. As liver fat increases, metabolic efficiency declines. The body starts struggling with blood sugar regulation. Inflammation rises and cortisol levels often become elevated. High cortisol levels place additional strain on circulation and collagen health. Cortisol can break down connective tissue proteins over time, making the skin under the eyes thinner and more fragile. This causes underlying blood vessels to become more visible, creating darker shadows and discoloration. At the same time, insulin resistance promotes sodium retention and fluid imbalance, worsening puffiness around the eyes. The liver also plays a critical role in protein production, especially albumin. Albumin helps regulate fluid balance inside blood vessels and tissues. When liver function declines, albumin production may decrease. This allows fluid to leak more easily into surrounding tissues, including the area under the eyes. Persistent under-eye swelling can sometimes reflect these deeper changes in protein metabolism and circulation. Another hidden connection involves nutrient storage and absorption. The liver stores essential nutrients like vitamin A, vitamin B12, iron, copper, and folate. It also supports the digestion and absorption of fat-soluble vitamins. When liver function becomes impaired, deficiencies can begin developing even if a person appears to be eating well. Vitamin deficiencies strongly affect skin quality and circulation around the eyes. Low vitamin K may worsen dark discoloration due to poor vascular integrity. Vitamin C deficiency weakens collagen production and capillary strength. Inadequate vitamin A can impair tissue repair and skin health. Iron deficiency reduces oxygen delivery to tissues, making dark circles appear even more pronounced. Poor sleep quality associated with liver stress can further intensify these problems. The liver performs many of its detoxification activities during nighttime hours. If blood sugar becomes unstable because of insulin resistance or liver dysfunction, cortisol and adrenaline may rise during sleep. This can interrupt deep restorative sleep cycles, increasing inflammation and worsening the appearance of fatigue around the eyes. Hormonal imbalance also contributes significantly. The liver helps break down excess estrogen and other hormones after they have completed their function. When detoxification slows down, hormones may remain elevated longer than they should. Hormonal imbalance increases fluid retention, inflammation, and vascular changes that can all become visible around the eyes. What makes this especially important is that many people focus only on cosmetic treatments without addressing the internal metabolic issue driving the problem. Eye creams, temporary treatments, and cosmetic procedures cannot fully correct chronic inflammation, insulin resistance, fatty liver disease, or nutrient deficiencies occurring internally. Supporting liver health often improves the appearance of the eyes naturally because it addresses the root cause. lowering sugar intake, reducing ultra-processed foods, improving insulin sensitivity, increasing antioxidant intake, and supporting healthy bile flow can dramatically reduce inflammation and fluid retention. Nutrients like choline, magnesium, zinc, selenium, and omega-3 fatty acids help protect liver cells and support metabolic recovery. Hydration is also essential because the liver relies heavily on proper fluid balance for detoxification pathways. Chronic dehydration can thicken circulation, impair lymphatic drainage, and worsen puffiness around the eyes. Your eyes are deeply connected to the health of your liver, hormones, metabolism, and circulatory system. Persistent dark circles and swelling may not simply be a cosmetic issue. They can serve as an early metabolic warning sign that your liver is under stress and your body is struggling to maintain balance internally. Dry, irritated, or constantly bloodshot eyes may seem like a simple eye problem, but in many cases, these symptoms can reflect something much deeper happening inside the liver. One of the liver's most overlooked functions is its role in nutrient storage, hormone regulation, and fat metabolism, all of which are essential for maintaining healthy eyes. When liver function begins to decline, the eyes often become one of the first organs to show visible signs of imbalance. One of the biggest reasons this happens involves vitamin A metabolism. Vitamin A is one of the most critical nutrients for eye health, and the liver is the body's primary storage site for this vitamin. In fact, a large percentage of the body's vitamin A reserve is stored directly inside liver cells. The liver not only stores vitamin A, but also converts it into active forms the body can use for vision, immune defense, and tissue repair. When the liver becomes stressed from fatty liver disease, chronic inflammation, alcohol exposure, insulin resistance, or toxin overload, its ability to process and store vitamin A becomes impaired. Over time, this can lead to functional vitamin A deficiency, even when a person believes they are consuming enough nutrients through food. The eyes depend heavily on vitamin A to maintain moisture and protect delicate surface tissues. Specialized cells inside the eyes require vitamin A to produce healthy tears and maintain the protective mucus layer covering the eye surface. Without adequate vitamin A activity, the eyes begin losing moisture rapidly, leading to dryness, irritation, burning sensations, and chronic discomfort. This deficiency also affects the retina, particularly the photoreceptor cells responsible for vision in low-light conditions. One of the earliest symptoms of declining vitamin A function is difficulty seeing at night or slower adjustment to darkness. Many people never connect this symptom to liver health because they assume it is purely an age-related vision issue. But vitamin A deficiency is only part of the story. Poor bile production caused by liver dysfunction also contributes significantly to eye problems. The liver produces bile, which is necessary for digesting and absorbing dietary fats. Since vitamin A is a fat-soluble vitamin, impaired bile flow dramatically reduces its absorption inside the intestines. This creates a double problem. First, the liver struggles to store and activate vitamin A. Second, the digestive system becomes less efficient at absorbing it from food. As a result, deficiency symptoms begin developing gradually throughout the body, especially in tissues that rely heavily on rapid cellular repair, including the eyes. Chronic inflammation associated with liver dysfunction further worsens eye irritation. When the liver becomes inflamed, inflammatory cytokines increase throughout the bloodstream. These inflammatory compounds affect blood vessels, immune activity, and tissue hydration. The tiny blood vessels inside the eyes become more reactive and sensitive, often leading to redness, burning sensations, and a bloodshot appearance. Oxidative stress also plays a major role. A healthy liver produces antioxidants like glutathione, which help neutralize free radicals and protect tissues from cellular damage. But when liver detoxification weakens, oxidative stress rises dramatically throughout the body. The eyes are especially vulnerable because they are constantly exposed to light and environmental stressors that generate oxidative damage. As antioxidant protection declines, the surface of the eyes becomes more inflamed and vulnerable to irritation. This may explain why some people experience persistent eye discomfort despite using lubricating drops or eye medications. Blood sugar imbalance connected to insulin resistance can also contribute to dry eyes. Elevated glucose levels damage small blood vessels and nerves that help regulate tear production. At the same time, insulin resistance increases systemic inflammation and worsens circulation to delicate eye tissues. This combination often leads to chronic dryness and poor healing of the eye surface. Hormonal imbalance is another hidden factor many people overlook. The liver helps metabolize excess hormones, including estrogen and cortisol. When hormone detoxification slows down, inflammatory changes throughout the body may increase. Hormonal fluctuations can affect tear production, fluid balance, and immune function within the eyes, making irritation and dryness even worse. The frightening part is that these symptoms often appear gradually, allowing liver dysfunction to progress silently for years. Many individuals focus entirely on treating the eyes themselves, while the underlying metabolic issue continues worsening internally. Supporting liver health is often one of the most effective ways to improve chronic eye irritation naturally. Reducing sugar intake, lowering processed food consumption, improving insulin sensitivity, and increasing intake of nutrient-dense foods can help restore metabolic balance. Foods rich in vitamin A precursors, zinc, omega-3 fatty acids, and antioxidants provide critical support for both liver function and eye tissue repair. Hydration is equally important because dehydration thickens tear film quality and places additional stress on detoxification systems. Supporting healthy bile flow through proper nutrition can also improve the absorption of fat-soluble vitamins needed for long-term eye protection. Your eyes are not isolated organs working independently from the rest of the body. They are deeply connected to liver health, nutrient metabolism, hormone balance, and inflammation. Persistent dryness, redness, and irritation may be far more than a surface-level eye problem. In many cases, they can serve as an early metabolic signal that the liver is struggling to maintain proper function internally. Tiny yellow deposits around the eyelids may seem harmless or purely cosmetic, but they can actually reveal serious metabolic problems developing deep inside the body. These soft yellow plaques, often found near the inner corners of the upper or lower eyelids, are known as xanthelasma. While many people ignore them, these deposits are frequently linked to fatty liver disease, insulin resistance, abnormal cholesterol metabolism, and impaired liver function. The reason these yellow patches form is directly connected to how the liver processes fats and regulates cholesterol. The liver acts as the central control center for lipid metabolism. It helps package, transport, store, and remove cholesterol and triglycerides from the bloodstream. When liver function becomes impaired, fat metabolism starts breaking down, causing cholesterol particles to accumulate where they should not, including underneath the delicate skin around the eyes. One of the most common drivers of this problem is insulin resistance. Chronically elevated insulin levels force the liver to convert excess sugar into fat through a process called de novo lipogenesis. Over time, this causes fat to accumulate inside liver cells, leading to non-alcoholic fatty liver disease. As the liver becomes overloaded with fat, its ability to regulate cholesterol efficiently declines. This creates a dangerous metabolic environment where triglycerides rise, protective HDL cholesterol often decreases, and harmful LDL particles become more oxidized and inflammatory. These unstable lipid particles can then begin depositing into tissues around the body, including the eyelids. Because the skin around the eyes is extremely thin and highly vascular, these cholesterol deposits often become visible there first. What makes xanthelasma especially important is that it can appear years before major cardiovascular symptoms develop. In many cases, these deposits are early warning signs of broader metabolic dysfunction involving the liver, pancreas, blood vessels, and hormone systems. The body is essentially revealing that fat processing and detoxification pathways are no longer functioning properly. The liver's role in bile production is another major factor. Bile is necessary for eliminating excess cholesterol from the body. The liver converts cholesterol into bile acids, which are eventually removed through digestion. But when bile flow becomes sluggish due to fatty liver disease, inflammation, or poor metabolic health, cholesterol removal slows down dramatically. Instead of being eliminated efficiently, cholesterol begins circulating excessively in the bloodstream and accumulating in tissues. Chronic inflammation further accelerates this process. Fatty liver disease creates ongoing oxidative stress and inflammatory signaling throughout the body. Inflammatory cytokines damage blood vessels and interfere with normal lipid transport. This promotes the buildup of cholesterol-rich material under the skin and inside arteries. Hormonal imbalance also plays a hidden role in cholesterol metabolism. The liver helps regulate and break down hormones such as estrogen, cortisol, and thyroid hormones. When liver detoxification weakens, hormonal imbalances may develop that further impair fat burning and metabolic efficiency. Low thyroid function, for example, can dramatically slow cholesterol clearance from the bloodstream. Since the liver converts inactive thyroid hormone T4 into the active form T3, poor liver health may indirectly contribute to sluggish metabolism and elevated cholesterol levels. This combination increases the risk of both xanthelasma and progressive fatty liver disease. Nutrient deficiencies can worsen the problem even further. Choline deficiency is particularly important because choline helps transport fat out of the liver. Without enough choline, fat becomes trapped inside liver cells, accelerating fatty liver progression. Deficiencies in omega-3 fatty acids, magnesium, zinc, and antioxidants also impair liver repair and increase oxidative stress. Blood sugar instability caused by insulin resistance compounds the issue. Frequent spikes in glucose trigger higher insulin production, promoting more fat storage and inflammation inside the liver. Over time, this cycle damages mitochondrial function, weakens cellular energy production, and disrupts normal cholesterol regulation. What many people fail to realize is that xanthelasma is often not just a skin issue. It can reflect deeper systemic metabolic stress affecting multiple organs simultaneously. The eyes simply become one of the first visible locations where this internal dysfunction reveals itself externally. Improving liver health often plays a major role in preventing further cholesterol deposits from forming. Lowering refined carbohydrate intake, reducing sugar consumption, improving insulin sensitivity, and supporting healthy bile flow can dramatically improve fat metabolism over time. Nutrients such as choline, omega-3 fatty acids, vitamin E, selenium, and antioxidants from vegetables help protect liver cells and improve lipid processing. Weight loss in individuals with fatty liver disease can also significantly reduce liver fat accumulation and improve insulin sensitivity. Even moderate reductions in liver fat may improve cholesterol handling and lower inflammatory stress throughout the body. The presence of yellow deposits around the eyes should never be viewed as merely cosmetic. In many cases, they represent an external warning sign of deeper metabolic dysfunction involving the liver, insulin, cholesterol regulation, and inflammation. The body often gives visible clues long before severe disease develops internally, and the eyes can become one of the clearest windows into those hidden metabolic problems. Blurred vision and constant eye fatigue are often blamed on screen time, aging, or lack of sleep. But in many cases, these symptoms may actually be connected to unstable blood sugar and declining liver function. The liver plays a central role in maintaining glucose balance, insulin sensitivity, energy production, and circulation throughout the body. When liver health begins to deteriorate, the eyes can become one of the first organs to suffer from the metabolic consequences. One of the liver's most important functions is regulating blood sugar stability. The liver stores glucose in the form of glycogen and releases it steadily between meals to maintain normal energy levels. This process helps stabilize the brain, nervous system, muscles, and eyes. But when liver function becomes impaired, especially in fatty liver disease, this regulation becomes disrupted. As insulin resistance develops, liver cells stop responding properly to insulin signals. The body begins producing higher amounts of insulin to compensate, but blood sugar still becomes unstable. This creates repeated spikes and crashes in glucose levels throughout the day. Those fluctuations directly affect the eyes because the lens and retina are highly sensitive to changes in blood sugar concentration. When blood glucose rises too high, excess sugar pulls fluid into the lens of the eye through osmotic pressure changes. This temporarily alters the shape and thickness of the lens, leading to blurry or fluctuating vision. Many people notice their vision becoming worse after high carbohydrate meals or periods of uncontrolled sugar intake without realizing the liver and insulin system are heavily involved. Over time, chronic blood sugar instability damages tiny blood vessels supplying oxygen and nutrients to the eyes. The retina contains one of the highest concentrations of small blood vessels in the body, making it extremely vulnerable to metabolic damage. Elevated glucose levels create inflammation inside these vessels, reducing circulation and impairing oxygen delivery to delicate retinal tissues. At the same time, insulin resistance increases oxidative stress throughout the body. The liver normally helps regulate antioxidant defenses, including the production of glutathione, one of the body's most important protective compounds. But when fatty liver disease develops, oxidative stress rises dramatically while antioxidant protection declines. This imbalance affects the eyes directly. Free radicals begin damaging retinal cells, proteins inside the lens, and nerve tissues involved in vision. As oxidative damage accumulates, people may experience eye fatigue, difficulty focusing, visual strain, or sensitivity to bright light. Mitochondrial dysfunction is another major factor linking liver health to eye fatigue. The liver plays a critical role in energy metabolism and nutrient processing. When liver cells become overloaded with fat and inflammation, mitochondrial energy production declines throughout the body. The eyes require enormous amounts of cellular energy because the visual system works continuously, even during small movements and adjustments in focus. When mitochondrial function weakens, the muscles controlling the eyes fatigue more quickly. This can lead to heaviness around the eyes, slower focusing ability, visual exhaustion, and difficulty maintaining sharp vision during reading or screen use. Vitamin deficiencies associated with liver dysfunction can worsen these symptoms even further. The liver stores and activates nutrients essential for healthy vision, including vitamin A, vitamin B12, zinc, and copper. Vitamin A supports retinal function and low-light vision, while B vitamins help maintain healthy nerves and blood vessels supplying the eyes. If liver function declines or bile flow becomes impaired, absorption of fat-soluble vitamins decreases significantly. This may contribute to blurry vision, poor night vision, dry eyes, and visual fatigue. Zinc deficiency can also impair vitamin A metabolism because zinc is required to transport vitamin A properly within the body. Hormonal imbalance connected to liver dysfunction adds another layer of stress to the visual system. The liver helps metabolize cortisol, estrogen, and thyroid hormones. When hormone clearance becomes impaired, metabolic rate and circulation may decline. Poor thyroid hormone activation, for example, can reduce cellular energy production and worsen fatigue throughout the eyes and nervous system. Chronic inflammation from insulin resistance also affects nerve signaling. Elevated inflammatory cytokines may interfere with communication between the brain and visual system, leading to slower visual processing and mental fatigue associated with prolonged eye use. The dangerous part is that many people view blurry vision as only an eye issue while ignoring the deeper metabolic dysfunction driving it internally. In reality, the eyes are often revealing early warning signs of insulin resistance, fatty liver disease, and unstable glucose regulation long before major organ damage becomes obvious. Improving liver health can significantly improve visual stability and reduce eye fatigue over time. Lowering refined carbohydrates and sugar intake helps reduce insulin spikes and stabilize blood glucose levels. Supporting insulin sensitivity through proper nutrition, movement, sleep quality, and stress management reduces inflammatory damage affecting the eyes. Nutrients like omega-3 fatty acids, magnesium, zinc, vitamin A precursors, and antioxidants from colorful vegetables help protect retinal tissue and support liver detoxification pathways simultaneously. Hydration is also essential because dehydration worsens blood viscosity and reduces circulation to delicate eye structures. Your eyes require stable metabolism, healthy circulation, balanced hormones, and efficient liver function to maintain clear vision and proper focus. Persistent blurry vision and eye fatigue may not simply be a vision problem. They can be powerful metabolic warning signs that the liver and blood sugar regulation systems are under significant stress internally.